Hi, I'm Dr. Marc Beauchamp. First, I'd like to thank you deeply for your trust. So, I will be with you for the whole healing process. We'll be together in that. So I will give you a lot of instructions and tips in order to have a beautiful healing. Just arrived home from your surgery. You had a local anesthesia, that is a regional anesthesia in the nerves of your neck that goes all the way down in your arm. So you're numb and you're paralyzed. That's the reason why we fit you with this orthosis for the first hours after your procedure. It was well adapted with Velcro and everything at the clinic. It might be uncomfortable, so you can do the Velcro to make it at your ease. There's no danger in that. And you have to know also that if the belt is uncomfortable for you, you can remove the fabric part from the belt, no problem. I will show you how. First, it is very easy to unclick like that, and you may remove the fabric part and just wear the fabric part, no problem. But it is advised to keep the orthosis for as long as you're paralyzed. Since you were told before the surgery not to eat and not to drink, it's probable that you come back home pretty hungry or thirsty. So we enjoy you to drink as much as you can to keep hydrated. Also, you can start to eat very progressively, and we ask you to be reasonable, starting first with the food that is easy to digest. It is advised to walk and to move yourself, as it will prevent constipation. When you come back home, you will find such a white bandage on top of your shoulder. Its purpose is to aspirate and to take the water from your surgery, from the shoulder itself, because we did shoulder arthroscopy. After dinner, you should take it off, and underneath you will find such band-aids, such sticky underneath, which you should leave untouched for the first 2 weeks. That is, until we remove the stitches. If the band-aid for reason or another gets dirty, you leave it there if it is dry. If for reason or another it falls apart by itself, you may put a band-aid, regular band-aid, elastoplast on top of it to replace it until your appointment to remove your stitches. When you came to my office or at the clinic, they gave you such a blue bag, which is a magic bag that you can put in the freezer, and it should be applied directly on the sticky in front and in the back to control your pain. So we enjoy you even before the anesthesia goes away to start the cooling down of your shoulder by applying it for 10 to 15 minutes, and also to repeat it every 2 or 4 hours in order to decrease the pain. As I told you in the office before the procedure, shoulder arthroscopy, even a small surgery or big surgery, will generate some pain, especially for the first 2 days after the procedure. So when you were operated on, you had a regional anesthesia. Of course, you did not feel anything, but such anesthesia will go away usually within 12 hours after your surgery. For the lucky ones, it may last for 24 hours, 36 hours. But I say that most people will have decrease of their regional anesthesia within 12 hours or so. So it is very important never to be behind in terms of pain control. So we prescribe you very strong medication in order to control such pain when the anesthesia goes away. So you should start with the strongest medication we prescribe you. Usually we prescribe hydromorphine we call it, Dilaudid, it's the same. So this should be started first, or the equivalent. And you should start it before the pain comes, as we said. So most people would benefit from taking it the first time, 2 pills around 8 o'clock, right after dinner, the first day. Dilaudid or morphine or the equivalent should be taken every 4 hours in order to be effective, especially the first 24 to 48 hours. So we enjoy you not to be shy to take it if it does not cause you any dizziness or any complication. If Dilaudid is too strong, then we just ask you to skip to the next level, which is codeine. Codeine commercially is called Amperset or Emtec, which is coated also with Tylenol. It is to be mentioned that if Dilaudid is not strong enough with 2 pills or 3 pills, it could be coupled with Tylenol or Advil. So the 3 of them can be taken all together for a stronger effect. There's no danger in that. It is to be remembered that if you take the codeine, which is coupled with Tylenol, as we said, You should not take on top of it some more Tylenol, because there's already Tylenol in the codeine Tylenol product that we give you. It is important not to take the strong medication for too long. So after a few days after surgery, if pain becomes tolerable, which is usually the 3rd day or the 4th day, you can switch to a mixture of Tylenol and Advil together. Again, as we told you in the office, it is important if you take any codeine or any morphine or any medication that is strong in that family, not to drive, since it will impair your ability to drive and your safety as well. It is important not to immerse your shoulder under the water for the first 2 weeks after your surgery. So please do not immerse in the bath or in a pool. You may take a shower, no problem. We ask you, if possible, to keep the Band-Aid dry for the first 3 days, and then you can take a shower, no problem, all over the body. But don't direct the flow directly on the Band-Aid. If it becomes wet, it's not a problem, you just dry it with a towel. Unless I gave you a specific order, that is not to move your shoulder, exercises usually can be started the very next day after surgery. So day 2, you start your exercises. You should start with things that are very light. There's no danger in flexing the elbow, moving your fingers as much as you want. Also, for the shoulder itself, we prefer to start with 2 exercises. The first one being the pendulum, the second one being what we call the close change, which we will show you later. The pendulum exercise is a very simple one and absolutely not dangerous. It is important to do it well though, and I will show you how. First thing, of course, is to take off your orthosis, and then you have to lean frontward and you let your arm go with the gravity. So you have to figure out that your arm now is something passive. It is not an active moving of your shoulder. It is rather a passive motion of your arm as you shake or as you move your body. So it should move just as if it were, let's say, a tie. Very passively, there's no danger in doing that. And then you can increase the size of the rounds in one direction and the other direction. You can do this 3 to 6 times every day. There's no danger in that, and it's highly advisable. I will now show you the technique of close chain. Close chain's principle is very easy because the table takes the weight of your arm, so this way it's a very safe positioning and there will be no tear in your shoulder whatsoever. So as the table takes the weight of your arm, the important thing is to have your hand applied solely on something that will glide on the table. That be in the front first, I will show you exactly. So you let your hand go in front of you as much as you can, so whenever you feel discomfort, pain, or stiffness, then you can come back very gently, very slowly, and you can do it again, just a little more, and so on according to your own tolerance. The same motion can be done on the side or in 45 degrees in order to open up the arm on the lateral side the way I do it. You just lean forward on the table and then your arm opens up by itself. It should be effortless, it should be painless. A lot of people ask us questions about physiotherapy. We'll say that in most cases, I say 90% of the time, physiotherapy will not be started until the 3rd month after surgery. So after your first appointment with me 2 months after surgery. So in some specific case, we might start it earlier and it will be told to you before you leave the clinic. Let's put it simply, the only real comfortable position after surgery of a shoulder is what we call the beach chair or the couch or the lazy boy position. In such a way, the weight of the arm will just bring the arm down and ease the pain at the surgery level. You may ask yourself what you can do with your arm that was operated on and what you cannot. So let's put it frankly. There's no danger for you to re-tear your shoulder, to injure your shoulder if you keep your arm close to your body. So you can bend your elbow, no problem, play with your hands, you can touch your mouth, you can touch your eyes, no problem. You can eat, you can ride, you can even drive if you want an automatic car, of course, if you don't take any Dilaudid or any morphine or any codeine. So there's no danger to do the daily activities, the normal activities. The only thing we do not want to do is to use your strength to lift your arm on top of your head. That could be dangerous. So we ask you until we give you the permission to keep your elbow close to your body, and there will be no problem. Activities after surgery are allowed, especially with the lower limbs. So there's no danger for you if you walk, or even if you run. Of course, if you do cycling or similar activities, it is important not to fall. So the running usually is not well tolerated the first weeks after surgery because of the bouncing effect. Walking is strongly encouraged. It is important that if you have any problem related to your lungs or to your heart, that you call not the office, not ourselves, but rather the 911. Let's say you have trouble with breathing or you have a chest pain, you call the 911, as it could be, it's improbable, but that could be a very important problem. For other worries that you may have that is not vital, you can call us 24 hours a day, 7 days a week. During the business hours, we would recommend you to call directly at the office. After business hours, you can call us or text us on the cell phone number that we gave you when you were discharged from the clinic. So all the instruction that we just gave you and all the tips can be found in this brochure that we gave you at the office. So please refer to it as much as you can. Of course, if there's any serious matter, any question you have that is not answered by it, you can call us anytime at the office or on the cell phone number we gave you. So it was a privilege really to be your doctor, and it will be a privilege to accompany you through your healing process. Thank you again.